Been, I think, one of the most effective drugs we've seen in clinical trials in my career, and it's really exciting that it will hopefully become a future treatment option for patients with breast cancer.
This is a huge breakthrough. It's a new line of attack in cancer. It's acting in a completely new way.
We're back with tales of a new drug. There's a new drug that's in its third stage. Actually, it's almost finished its clinical trials. I think it's on a third stage. This drug is targeted medicine to shown really good benefits and promising for patients with advanced breast cancer. This is a major phase 3 clinical trial. The findings of this drug was presented at the San Antonio Breast Cancer Symposium. This drug is called capivasertib. So capivasertib, I hope I'm pronouncing this correctly, is basically a new treatment for people with a particular type of genetic disposition, with a particular type of cancer. So a lot of times I made a video about how a lot of cancer treatments are being custom made through genes. And with this particular drug, it focuses on people with this gene. And they use a gene profiler to determine what type of treatment to give to cancer patients. So this particular treatment, capivasertib, is used in combination with hormone therapy. And capivasertib, I hope I'm pronouncing this correctly, it's targeted for people with a particular genetic disposition. It's called, I'm not going to get into details because I don't want to confuse people. This is for us lay people. From what I understand, 2/3 of people with breast cancer carry this gene. So this would basically help those 2/3 of people who have breast cancer. Okay, the drug was found to be effective across all patients treated in the trial, and this included patients with tumors with mutations in the AKT signaling pathway. Okay, what AKT is, it's like a protein, and it signals cells for things like cell growth and that type of thing. So the pathway of this signal, the tumors mutate in that pathway. So this drug focuses on that pathway. And what this does is it blocks or inhibits the cancer growth. The way it does this is it inhibits the cancer-driving protein molecule, and the molecule is AKT. Basically, it sends signals to the cells. So it focuses on that pathway, and it blocks, I guess, communication. Basically, blocks that protein molecule. And this capivasertib was discovered by AstraZeneca. I think AstraZeneca had a partial license. They were partnering with a research institute in the UK. It's called Astex Pharmaceuticals. Yeah, ASTEX. So AstraZeneca was partnering with Astex Pharmaceuticals, and I think AstraZeneca has part of this license. So this research was focusing on this particular protein, which is related to a genetic makeup of certain people. Okay, so the drug is targeted to a particular genetic makeup of people, most of which have this particular form of breast cancer. So this drug would basically help 2/3 of people with breast cancer. Pardon me, getting tongue-tied again. So the trial, it enrolled 708 women and men together, and they had this particular genetic makeup, who have an advanced form of this cancer. So this treatment treats those people who are in the later stages, who have an advanced form, and it can make the cancer more treatable. It's not for curing. It's almost like, I hate to use this comparison, I really hate to use it, but it's almost like saying, okay, we can't get rid of it, but we can treat it to make it like go away or in remission. I guess it's like, I want to say those diseases, herpes, or where they give people treatments. There's no cure, but they can just make it looks like it's going away. So in this case, people who have later stages of this cancer, later developments, they can live longer with this drug. There was an example of a lady. I saw her testimonial. She was basically cured from cancer 20 years earlier. I guess it made her 45. So, because now she's 65 and the cancer came back. And basically they give her this treatment and she feels like it's gonna prolong her life. So I guess it helps you live with cancer. These days, with a lot of cancers, you hear of people fighting cancer for 20 years. I fought cancer for 30 years. So cancer is not exactly a death sentence. It's becoming, in a lot of cases, depends on the cancer, a difficult way to live. Yes, very difficult way to live. I mean, it's still not good at all, but latest developments, or all the developments, have turned cancer from a death sentence to more of just a extremely bad inconvenience, or in some cases just a real worse than a headache, just a real horrible thing to live with. But the fact that people can carry on for 20 more years, another 5 more years, it's encouraging news. So basically, with standard hormone treatments, the majority of these patients had the cancer reoccur. So they provide them with hormone treatments, the cancer slows down, and it comes back. Now the drugs, they block those cancer cells from multiplying. In the current practice, the patients continue to receive the hormone therapy, but it's often combined with this drug to give it a more boost, because the hormone therapy kind of makes it more weak. Some of these cancer cells can be resilient. They can shrink and increase to help survive treatment. So a lot of cases, they kind of just use combination of things. So they say this drug looks a bit more promising with very minimal side effects. I think that anything is better than chemo. You know, we've all seen people go through chemo. It's just a horrible thing. I don't want to see anybody go through this. It's just, and it's sad that so many people have to deal with this. It's really sad, and it's just frustrating. And I think people are just tired of people dying. And I mean, I think also, it's another video, but preventative measures can be used as a society, which that again is another video. But yeah, sometimes the hormone therapy is not enough, and a lot of these people are forced, or they just have no other choice but to go through chemo, which has serious side effects that just put people in a lot of pain and inconvenience. So this new drug is a way to kind of replace chemo and help the patient live with this advanced cancer without any side effects or other things to stop them from living their life to the fullest. It basically slows the cancer from growing. In many cases, it shrinks the tumors. Specifically, it shrank the tumor 23% in 23% of the patients who received the drug in combination with the hormone therapy, whereas the hormone therapy alone shrank the tumors in 12% of the patients. And it basically kept the cancer from growing fast. Let's say if the tumor grew in 3 months and then you see the person suffering. In this case, in this trial, a limited form, it took the tumors 7 months to grow. So again, this is promising. It slows down the tumors, and in some cases it shrinks them. And it shrinks them in this by targeting this AKT pathway, what I mentioned earlier, this protein. And again, it's genetically related to how the patient is made up, right? It's a patient's genetic makeup that determines this treatment. So not every patient who has cancer can take this treatment. They have particular, cancer is related to genes. So they have to have a particular genetic makeup, a particular protein, the way the protein is developed, the way the protein is signaled, that helps these patients qualify for this treatment. It's just they're doing this because the majority of breast cancer patients have this genetic makeup, which makes sense. And they also use a tumor profiling, which is also involved a profile of the cancer, which is also genetic profiling again. It goes back to gene profiling, and they determined that 41% of patients on the trial had this particular tumor. Okay, so the group was treated with the drug, and it takes an average of 7.3 months for the cancer to worsen, compared with 3.1 months for those who just received hormone therapy alone. And 29% of patients with this pathway addressed by the drug, they saw their tumors shrink following their treatment, compared with just 9% who just received a placebo and the hormone therapy. I'm going to also play a particular video that goes into more detail. It's a short video. It talks about how cancer is addressed and how this treatment works for the patients. It's pretty informative, and it kind of filled in the blanks for me. So next is this video.
Been, I think, one of the most effective drugs we've seen in clinical trials in my career, and it's really exciting that it will hopefully become a future treatment option for patients with breast cancer.
This is a huge breakthrough. It's a new line of attack in cancer. It's acting in a completely new way.
And I hope the video was informative for you. I want to thank you for your time. Please like and subscribe, and thank you again for listening.